Good morning, Peter Goertz. I'm a psychiatrist. I had a sad experience this past week. I saw a patient, and this scenario pertains to the question, can abuse cause schizophrenia? The patient I saw in an emergency room was a young man, and he was quite troubled. He was not thinking in an organized way, and a family member of his with whom he was living had arranged for him to be brought to the hospital. And while the patient was in the hospital, in the emergency room, after I spoke with him, I spoke with a different family member, and that other family member said some things that were very interesting to me. What the other family member said is the first family member with whom the patient was living had been abusing the patient for many years, basically since he was born, neglecting him, really bad abuse. And this family member who told me that said that the abuse was still ongoing. So that creates a very difficult scenario because the first family member who reportedly was abusing the patient and who had been abusing the patient for many years, arranged for the patient to be brought to the hospital. And the patient was saying that's not fair. And probably to an extent, he had a point. Of course, he was really not thinking clearly also. But the second family member, the one who told me about the abuse, about the reported abuse, was very clear in what they were saying and said the abuse had been going on for many years, basically again since the patient was born. So this is not something that I saw for the first time or that came to my attention for the first time. I've been asking myself for many years, can abuse contribute to schizophrenia or maybe even cause schizophrenia? There, of course, are other roots or potential roots of schizophrenia, genetic roots, biological roots. And I've actually had two patients tell me that, and they'd both been diagnosed with schizophrenia, two patients told me that their psychiatric symptoms, their schizophrenia, started shortly after they used LSD. So it was a residual effect, in their opinion, or based on what they said, it was potentially a residual effect of having used LSD. Now, abuse, of course, can cause low self-esteem, and that can have social consequences. The patient may have difficulty interacting socially with others. Abuse potentially could have consequences on brain development, and also the abuse might affect epigenetic functioning. So the abuse might affect which parts of the DNA, of the patient's DNA, are being read and which ones not. So abuse, in other words, can be quite pervasive in affecting someone's life. So to me, it seems possible that abuse can contribute to symptoms of schizophrenia and maybe even cause schizophrenia. As far as treatment of schizophrenia, one major part of that is antipsychotic drugs. But based on what I'm saying, we don't want to neglect other aspects, because if abuse at least may contribute to schizophrenia, then there are some psychosocial roots of schizophrenia, at least in some patients. So we don't want to forget psychotherapy, at least supportive psychotherapy in schizophrenic patients. And that reminds me of an older psychiatrist I used to work with in a hospital. And he'd been at that hospital for, I think, 40 years maybe. And he told me that way back in the 60s, I think, some schizophrenic patients were being seen for psychotherapy 3 times a week. And he said it was helpful for them. So very interesting. Nowadays, it's unheard of to my knowledge, but it's interesting to hear that as an option potentially, because again, there can potentially be some psychosocial roots of schizophrenia. Another thing that could help might be group therapy also, any kind of support, socializing. And another basic thing is kindness. You want to treat these people in a kind way and not just focus on medication, whether or not psychosocial issues are at the root of a person's symptoms. Just a kind approach in general helps. Thank you.